Hi, today we're going to talk about musculoskeletal ultrasound. Specifically, we're just going to focus on the lower extremity. So you guys will have had, by this point, the experience of having gone through and used the linear probe pretty frequently to look at nerves and to look at veins. We're going to do that a little bit today, but we will be mostly focusing on the joint itself, specifically the knee. So first and foremost, what you're going to need is going to be an ultrasound machine and the high-frequency linear probe, so named because it's a linear or straight line on the top. That linear probe is a high-frequency probe, great at looking at superficial things and giving you a lot of data about them, but not so good at looking at deep structures. The joint, as we discussed, you're going to be looking at is the knee. So we're going to examine this, which is the quadriceps tendon. We're going to examine this, which is the patellar tendon. We're going to examine the actual space, looking for an effusion, and then we're going to talk about a couple of other things. So first and foremost, when you're going to assess this joint, the first thing I'd like you to plan to do is to look at look first at the quadriceps tendon. To do that, the easiest way to do it is to come in short axis first. So there's the probe. It's looking at the tendon which runs superior to inferior, and it's looking at it in a short axis. And you'd see, as you're looking at this, you'll see here's the top of the ultrasound screen itself. Here's skin, here's subcutaneous tissue, here's muscle. And then all the way down here, you see this bright white or hyperechoic line that shadows everything behind it. So this line represents bone. Specifically, since it's above the knee joint itself, this would represent the two femoral condyles. Up here, this small black space, you could imagine could be an effusion, but actually it represents the articular cartilage, which is also very fluid filled, and as a result will look hypoechoic on ultrasound. And then up here, you see the structure. Now, the structure could be muscle or it could be tendon. The way you tell the difference is that tendon is typically significantly more hyperechoic, so it's very bright, it's bright white, versus muscle is typically a little bit more isoechoic to the structures around it. So you'll see multiple muscles in that area. So as we're going through that area, you can see here, as they're fanning through, you can see right here that there is muscle that's now become this bright white area in the center, and that would be the quadriceps tendon itself, and you can see that as they fan through. Once they've done that, you'd have another view of the same thing, just showing you more examples of how you'd see the distinction between tendon there and the muscle itself on the superior portion. And you can see the femoral condyles better as you go through with the articular cartilage. Great. Next up, you would then rotate the probe, and in this case the probe marker should be to the head, and you'd be looking to see if you could see this in long axis. So as a reminder, for diagnostic ultrasound, the convention we follow is typically probe marker to the right or probe marker to the head. In this case, we would do it to the head. Here, you would therefore see that this is towards the feet, this side is towards the head, since the probe marker will be to the head. You'll see over here that there is a structure, this one, that appears to extend all the way down over the bone. And you can see that as you're looking at it, it's got these sort of straight striated looking lines. This is what tendon looks like in long axis. You can see that there's a tiny amount of articular fluid, or a tiny amount of fluid around it, which is normal. Nothing there that would look concerning. Great. So this is a good point to introduce a physics concept that you'll hear about. It's called anisotropy. Essentially, when you're perpendicular to the structure, especially something like a tendon, you'll see that it looks nice and bright. If your angle is off, if you're looking at it at an inappropriate angle, you'll end up showing that it's dark. The reason this matters is because if you're not careful, it can easily make something that is actually your tendon look like not tendon. So this is tendon here. But when you can see that they're a little bit off axis, it starts to get a little more gray, as opposed to the bright white it should be. So that's helpful to at least keep that in mind. Great. So once we've looked at the quadriceps tendon, we then come down and look at the patellar tendon. Specifically, you'd be putting the probe just inferior to the patella itself, and then you'd be sliding inferiorly, probe marker to the right, and you'd be moving so slowly. And you would see, here's bone, so right here this is bone, so this would be tibia, and then right above it, you're looking to see muscle here, that is then becoming this hyperechoic, bright white, thin strip, and that would be muscle converting into tendon as you go. Great. Moving on, you see the same thing again. And then in long axis, you would see again that bright white striated line that should get pretty familiar. As a reminder, in this one, the bone you're looking for it to attach to, specifically the patella, is going to be superior because you're now inferior to it. Great. Okay, so the things you'd typically be looking for here are going to be the patellar ligament, and you'd be looking for the tibia itself. You can sometimes see a fat pad. The other thing that's super helpful is you can often see an effusion. So what you'd be looking for is you'd see here, you'd see that there is a whole amount of white space, a whole amount of black space all the way around the joint itself. And that black space would be suggestive of an effusion or a fluid collection. And that can be something that needs to be drained potentially or not, depending on the clinical situation. Great. The last thing we're briefly going to talk about is, I know you guys did nerve block lab recently, but the important point to think about is that when you're looking at a nerve, you're expecting to see sort of this exact histopathology slide kind of replicated in ultrasound, which is super cool. So if you look, you can actually see right here, this bright white line that surrounds it would be the epineurium. And then the perineurium and your fascicles are those little black circles surrounded by white, the white being the perineurium. And that ends up giving you the sort of characteristic cluster of grapes almost appearance, and then anatomically you need to know what that looks like. The reason this matters is because if you're trying to figure out if it's a nerve, it would look like this. And if this looks familiar, that's no accident, because tendons kind of look like this, right? Like bright white striated lines. Now the trick is, figuring out if it's a tendon or a nerve is to track it, because a tendon by definition should convert into muscle versus a nerve should stay looking like a nerve. So the next step you're going to do is to look at the popliteal sciatic nerve. It runs posterior to the thigh itself, or posterior to the tibia itself, runs back through the back of the knee, and it goes all the way down to the foot. And you're looking for a bundle of nerves, and I'll walk you through the anatomy here as we go. So first and foremost, you'll see skin up there, subcutaneous tissue. This would be a vessel, this would be another vessel. And then you're looking to see this bundle of grapes thing that kind of appeared on the screen. I'll play it through one more time. Right there again, you can see it and track it down. So that would be a nerve. Contrast that with the muscle right here, and that'll help you see the difference between the two. And again, you can see here, now that popliteal sciatic nerve is actually going to split. So you'll see here, this is the junction as they're going superior, this is a split down here. So you'll see a nerve here and a nerve here. Great. If you have any questions, you know how to email me. If not, see you guys soon.